Hi, everyone. So we're finally at the last presentation of this symposium. It's been so amazing hearing all these wonderful presentations. So for our last panel, we're actually going to talk about tobacco. Why are we talking about tobacco? Because tobacco use can lead to cancer and a lot of different diseases, including diabetes. So my name is Alice Wang. I'm a health educator from Herald Christian Health Center. And we have invited amazing panelists for this panel. And first one I would like to introduce is Ms. Cynthia Zhang. And Cindy is the unit manager for the community engagement and cessation and clinical intervention units with the Los Angeles County Department of Public Health, Chronic Disease and Injury Prevention Division, Tobacco Control and Prevention Program. We're also very honored to invite Dr. Zhang Ma. Dr. Ma is a general surgeon in San Francisco who serves on the California Tobacco Education Research Oversight Committee as a representative from the American Heart Association. And presenting with Dr. Ma is Michelle Zhang. She is the high school chair for the American Cancer Society Youth Ambassadors Program. And joining us all the way from San Diego today is the amazing Cherry Ng. She's the program manager of the Asian Smokers Quitline. And without further ado, let's welcome Cindy for the presentation.
Hi, thank you for allowing me to come here on board. And I had a question if I just go ahead and ask people to advance the slides for me. If someone could advance the slides.
Yes, Cindy will help you advance the slides.
Thank you. So we're working in the Los Angeles County area. And as you know, Los Angeles County is huge. It's over 4,000 square miles. We have a population of more than 10 million people. We have 88 incorporated cities and 140 unincorporated areas. Next slide, please. We've done a great job in the work that we've been doing in LA County with policy as well as for our cessation work. In 2018, our smoking rate was at 11.2%. Currently, we're at 6.0%. However, we do see high levels of smoking or smoking rates in certain geographic areas as well as for our low SES groups. And that can be described as being those who are struggling to make ends meet. And so we see that Latinx, non-Hispanic white, Black African American rates are higher than what the overall rate is. What I'd like to point out is the Asian rates that have been reported in 2018 and 2023. We do not have enough people who are Asian who are responding to our LA County Health Survey. This survey helps drive decisions in terms of funding and programming that's done to help work with our population in terms of prevention. Next slide. Other groups, LGBTQ+ and homelessness, again, also have very high rates. If you compare it from 2018 to 2023 and with our current rate at 6%. Next slide, please. Those who abuse alcohol also have high rates at 11.2%, and those who experience frequent mental distress at 12.6%. Next slide, please. Now, the tobacco companies are well aware of the drop of our smoking rates within LA County as well as the state and across the nation. What we are seeing is a big push from tobacco companies for alternate tobacco products like vaping, snus, Zyn, and some of these other different tobacco products. Overall, the Los Angeles vaping rate is at 12.3% in 2018, and currently in 2013, our vaping rate is at 11.7%. There are more males that vape than females. However, we are seeing an upward trend in females who are vaping. Next slide. There's also breakdown in terms of age, and we see that those that are between the age of 18 to 49 have higher rates of vaping. And in fact, between 25 to 49, we've seen an increase in those that are vaping. Next slide. Overall, the vaping rates are elevated. For Latinx, it's at 11.4. And you can read the numbers as well, Nye. I'm trying to be mindful of time. What I want to point out is that for the Native Hawaiian or Pacific Islander and the American Indian or Alaska Native, there were not enough respondents to the LA County Health Survey or any that responded. So we can't even predict what the prevalence rates are or the smoking rates are for this particular group. And as a result of that, if we're having to prioritize the work that we're doing, these groups may not be addressed in terms of smoking prevention and programs to help support cessation efforts. For non-Hispanic, multi-race, or other races, it was at 6.2%, but alarmingly, the rates are now at 16.8% in 2023. Next slide. We know that about 1 in 4 tobacco users are dual users for both cigarettes, where they're using cigarettes and e-cigarettes. Next slide. Now, the common thread between all of these products is nicotine, and nicotine addiction is what we're concerned about. With all of these products, nicotine comes from tobacco plants, and that nicotine is also manufactured, the synthetic nicotine, but we're also seeing nicotine analogs that are coming out on the market. And these are chemicals that have a slightly different structure than nicotine, but still have the same effects. Next slide. Now, why are we so concerned about nicotine, and why are nicotine in all these products? And what we see is that nicotine is a stimulant. It makes people feel energetic, alive, more alert. It also stimulates the reward system in the brain, and it makes people feel good. And in fact, it can even enhance learning. If you could please click the button again. Next slide. Stop there, please. The problem is that you need more and more nicotine to feel good. But over time, you need the nicotine just to feel normal because the body does not respond to nicotine in the same way. Nicotine is as addictive as heroin. Nicotine is what drives the behavior that makes people want to reach for that cigarette or want to vape or use other nicotine products. Nicotine's effects are focused in the brain. Next slide. And so we need to understand that brain development continues until about the age of 25. And each time a new memory is created or a new skill is learned, stronger connections are built between those brain cells. Young people's brains build connections between brain cells more quickly than adult brains. Kids learn faster than we who are older. Next slide. And so we need to think of nicotine as being poison to a teen's brain. It affects the part of the brain that's responsible for attention, learning, and memory. It can worsen anxiety, irritability, and impulsivity, and it can lead to long-term effects on the ability to make decisions. And it increases the risk of addiction to other substances. So it's not benign. It's not safe. Nicotine in any form or in any product. Next slide. So cigarettes is kind of the common exchange that we think of whenever we're thinking about the harm of using tobacco products. So one cigarette is equal to 10 to 12 milligrams of nicotine. There's a tremendous amount of difference between nicotine that exists in the different tobacco brands. It can range from 6 milligrams to 28 milligrams. Out of that, only 1.2 to 1.8 milligrams enter the body for each cigarette smoked. A pack of cigarettes is equal to 22 to 36 milligrams of nicotine. Next slide. The average pipe, keeping that in mind, is equivalent to about a pack and a quarter of cigarettes. So pipe smoking is not safer. Large cigars are equal to about a half a pack of cigarettes. Next slide. Hookah was thought to be because it's being filtered through water. But 20 minutes on a hookah pipe is equivalent to 25 cigarettes or one pack of cigarettes. Next slide. There's a whole host of other products, vaping products. So Elfbar, Escoview, Juul, Mr. Fogg. Next slide, please. One of the most popular ones that we are currently seeing are geek bars. It's a vaping device. 15,000 puffs are available in one of the geek bars, and that's equivalent to 40 packs of cigarettes. Flume has 20,000 puffs, and that's equal to about 37.5 packs of cigarettes in terms of nicotine. It's not safer because it's vaping. Next slide. Okay. Now, one slide that I forgot to put in is on Zyn. And this is a product that we're seeing out on the market now that a lot of people are using. It was recently FDA approved for sale. It comes in 3 and 6 milligram pouches, or sorry, 3 to 6 milligrams of nicotine per pouch. Each tin contains about 15 pouches. And if you just do the math, it's 45 milligrams of nicotine. And so 1 tin of Zyn at the 3 milligram strength is equal to about a pack and a quarter cigarettes of nicotine, and a 6 milligram pack is about 2.5 to 3 packs of cigarettes. Next slide. So in understanding, if you can go back one more, please. Thinking about the types of products that we're seeing on the market, as well as what our data is showing us, where we're seeing higher amounts of smoking or vaping or the use of alternate tobacco products. LA County has developed learning collaboratives that are specific to throughout Los Angeles County in each of the spas. Now we can go to the next slide. And so in particular, City of Hope Medical Center is working with Asian and Asian Americans, as well as with the Pacific Islander, Native Hawaiian, American Indian, and Alaskan Natives to do tobacco cessation services. It was a little bit of a fight to keep them on our list because because the numbers appear low, there's always been the consideration of potentially combining these groups with other groups. And my position has always been that we have to make sure that we're dealing with these groups separately and are spending the time to develop cessation programs that meet their needs. So the other priority populations that our learning collaboratives are working with are the rural, homeless, people who are at risk for homelessness, Latinx, LGBTQ+, African American, and our learning collaborative where they are at and work with different languages, different approaches, and address cultural nuances to make our interventions appropriate for all the different populations. Each strategy that's been developed has been very novel. So there's been pop-up clinics, parking lot clinics, working with faith-based organizations, etc. We do a lot of training for clinical providers and community-based organizations, and as well as with community members. And I figure this is about as good a time as any, but we're always looking for people to help us with the learning collaboratives and to help provide input, community members, as well as community-based organizations. Next slide, please.
Thank you so much, Cindy, for that wonderful presentation.
And just lastly, if you have any questions, because it's a whole other presentation to talk about the activities of our learning collaborative, please feel free to email me at this email address, or you can contact Sophia Young at City of Hope, and she can provide you with information with our learning collaborative. And thank you very much.
Thank you very much, Cindy. And next, let's welcome Michelle and Dr. Ma for their presentation.
Hello, everyone. My name is Michelle, and I'm honored to be here as a speaker for the 2025 Symposium. I'd like to extend my gratitude to Sophia, of course, and the Symposium Committee for inviting me. And with that, let's get started. So I will be presenting the relationships of tobacco and cigarettes, the low-tar myth, and reduced nicotine. I created this presentation in tandem with Dr. Ma, but my presentation will set the foundation for his. Next slide, please. So this is just a brief table of contents. First is the article introduction. I'll get into that very quickly. Second is the introduction to the low-tar lie. And then third is domestic international action. And then we have what I see like my role as an ACSY YA youth lead and how this interacts with what I've been able to find. Next slide, please. So just an article introduction. Basically, this is the article I published with Dr. Ma last year, I think December. We worked on this for, I think, 1.5 years before publishing it. And in this panel, I'll be basically presenting and sharing some key points that we found and what we believe to be important takeaways. Next slide, please. So this is obviously, we know how addictive tobacco is, and the government needed a way to kind of test to make sure the addictive chemicals are safe or like somewhat safe for consumption. And then this is where the ISO method comes in, the International Organization for Standardization. Basically, a machine will stimulate regular puffs on a cigarette and then collect and analyze the emissions that would typically be inhaled or exhaled by a smoker. And this test was later then adopted globally by the FTC and a lot of countries worldwide. And it essentially tests for TNCO, or tar, nicotine, and carbon monoxide in cigarettes. Next slide, please. But unfortunately, it was later found that the tobacco industry actually created small ventilation holes in cigarettes to allow for external air to dilute the smoke stream and lower TNCO, which is the tar, nicotine, and carbon monoxide measurements, to kind of meet allowable standards. As we can see from the picture on the left, real-time smokers, they commonly close these holes with their fingertips or lips when they're inhaling. And they also smoke in a manner that's like drastically different from the FTC or the ISO method that was initially instated. For example, they smoke in higher puffs and less time between these puffs. So they actually inhale more chemicals. And as you can see from the picture on the right, the two orange circles, these are the little holes that the tobacco industry, they put in the cigarette. So kind of external air is able to dilute the chemicals to make it seem more healthy. Next slide, please. So for domestic and international action, first comes reduced nicotine domestically. After many calls for action, after realizing how useless the ISO method was, the FDA issued a notice for proposed rulemaking aimed at setting a maximum allowable nicotine level for cigarettes. This was initiated in spring of 2022 by the past Biden administration Cancer Moonshot Initiative. Next slide, please. And in 2017, the FDA Commissioner Scott Gottlieb announced a framework that could actually lead the agency to set a tobacco limiting standard. In 2018, the next year, Commissioner Gottlieb estimated that around 5 million adult smokers could quit within a year of the plan's introduction. So basically, this goes back to the prevention efforts of how reduced nicotine is a possible domestic way to alleviate the negative effects of tobacco use by decreasing and setting a standard on them allow nicotine in cigarettes. Next slide, please. Of course, accompanying domestic action is international action. And basically, after seeing the way that tobacco industry was able to kind of exploit the ISO method, Canada and Netherlands, they actually championed the way by championing the World Health Organization intense method, which is based off of the Canadian intense method. WHO intense method uses tape to close off the ventilation holes. And a puff volume and rate almost twice the amount of that the ISO method uses. So it actually resembles a human smoking behavior more accurately. And as we can see from the figure on the left, unlike the ISO method, that there's a tape that closes and like stops the holes. So it's the TNCO methods aren't able to be diluted. Next slide, please. And an example of international action is actually Singapore. So they have smoke-free legislation and also advertising bans, which has been actually very instrumental in reducing smoking rates. These laws don't just target like individual smokers, but it actually targets a lot of public spaces. So not only decreases smoking from individuals, but it also decreases people's exposure to secondhand smoking. And it's been linked to significant health successes. For example, research indicates that up to 20,000 heart attacks have been prevented due to these laws, and cigarettes has smoke daily is often dropped by almost 5%. Later, these laws were able to expand to encompass all national parks, education institutions. So Singapore is actually able to achieve an almost smoke-free environment. And this is something Dr. Ma and I believe that a lot of other Asian countries or even the US could take into consideration, especially when thinking about the impact of smoking and the prevalence of smoking in a lot of big countries. Next slide, please. So this is just a picture, like when you go into the Singaporean airport, there's a big banner that's like tells the visitors and travelers that these items, these tobacco items are banned, and you could be fined heavily if you do bring them in. Next slide, please. So then going on to my role as an ACSYA high school chair, basically with Richard, which is one of our college chairs, and Sebastian, which are our other one, and Sophia, who is our advisor for ACSYA. I'm in charge of training and facilitating more youth leads for our organization. And I also find a key aspect why our organization's interesting is because of the engaging with the community and our facilitators, because we have monthly meetings every month that we host on a Sunday. And also, I want to highlight our ACSYA Stop program because I think it correlates best with my presentation with tobacco, especially because it's built to inform people about the dangers of tobacco. And we advocate for tobacco cessation through education, training, and further participation. There's also a prevention of tobacco and vaping through education and cessation support. I want to highlight the the monthly meetings that we have. We have like a new facilitator every meeting where Sophia, Sebastian, which is the ACSYA Stop lead, college lead, and Annie, who is our ACSYA youth Stop lead. They mentor that person and advise them on the presentation. This presentation has been pre-created with information, so the facilitator has to really engage with the information, engage with the audience, and make sure they are aware and know how to interact with the information. There's also a great deal of community outreach because, for example, the picture on the right is one of the ACSYA Stop's initiative of the pledge. Basically, at Relay for Life events, they set up booths for ACSYA Stop and passed around these pledges, kind of increasing awareness and increasing support for tobacco cessation. And as the high school chair, it's honestly great to see how this organization, especially ACSYA Stop, has been able to grow and expand. And the team behind ACSYA really hopes that we can reach more supporters in the future. And that's it for my presentation. Thank you for listening.
Thank you so much, Michelle and Dr. Ma.
Thank you so much. Good afternoon, everyone. It's really an honor to be here. I'd like to thank Sophia and Michelle for the invitation to speak today and to share my perspective as a member of both TEROC and TRDRP, two statewide organizations in tobacco control. And I've reflected that in a different world, the Tobacco Master Settlement of 1998 and the subsequent 2006 RICO litigation could have been the end for big tobacco. These actions resulted in a $206 billion nationwide settlement. It forced the tobacco industry to change their marketing practices. It funded the Truth Initiative to help lead tobacco control efforts nationally. But it's really interesting that instead in 2025, we have a former tobacco industry lobbyist as the chief of staff for the Trump White House. The infrastructure for federal tobacco control is being dismantled. Much of the CDC staff at the Office on Smoking and Health have been let go. An upcoming study, another U.S. Surgeon General's report on smoking had to be shelved after the editorial staff were all released. A North Carolina T-Corps is closed. Surgeon General Vivek Murthy's report on tobacco control was removed from the CDC website. Just 4 days after the inauguration in the White House, the menthol rule was withdrawn. It's interesting that the tobacco industry was the largest corporate donor to the Trump campaign, and it appears that their return on investment has been very strong in response. In 2022, Philip Morris acquired Zyn for $16 billion, and their stock shortly afterwards hit an all-time high. The most profitable stock in the history of Wall Street in the 20th century was Altria. If you invested just $1 in 1900, it would be worth nearly $2.5 million today. The tobacco industry revenue globally is predicted to reach nearly $1 trillion in 2025 this year globally, having accelerated over the past few years. And all of this profit comes at an enormous burden to the U.S. healthcare system, with smoking-related illnesses costing $600 billion in 2018, of which $240 billion were in healthcare spending and $372 billion in lost productivity. In 2024, the U.S. Surgeon General increased the estimate to 490,000 American deaths annually from tobacco use, 473,000 from firsthand smoking, another 19,000 from secondhand smoking. And I hope someday that researchers, perhaps someone in this audience, will be able to provide an estimate of the number of deaths related to exposure to third-hand smoke. So all of these changes, unfortunately, are a major setback for the AAPI community and in cancer prevention. So we have to ask ourselves, what can we do next? The federal options and action appear limited. What may happen in the future? Juul submitted a pre-market application. and perhaps they'll receive their authorization to sell their products again across the nation. We've heard that oral nicotine pouch use is accelerating in high school. If you're interested, there is one tobacco control piece of legislation from the Biden administration that's still moving forward. It is the idea of the reduced nicotine cigarette that Michelle was just spoken about. She highlighted the myths of the low tar lie and the upcoming court ruling in Europe that could have possible implications for America in the future. I'll share another source of hope is the tobacco-free generation birth year phase-out idea that's been gaining traction nationally. I'm pleased to report that the California Medical Association has had policy from the 1980s urging an end to the sales of all tobacco products in California by the year 2000, 25 years ago. But to try to get us to that goal, they recently adopted visionary policy that supports pilots to study further the idea of raising the legal age to purchase cigarettes every day as time passes. This concept, the birth year phase out of locking the legal birth date of sales, of legal sales, has now been adopted in 16 cities, in the state of Massachusetts. And they, along with the New England delegation, unanimously submitted a resolution to the American Medical Association that will be heard in June, urging national action on that topic. But I think for today's discussion, I think the area for us to focus on is in state and local activity. That's why I'm most appreciative of the chance to share my insights today. And I applaud all the efforts that you are undertaking to improve the condition in our state. You know, there is some reason to be optimistic. The good news is that California is approaching the endgame goal of reaching a combustible smoking rate under 5%. We're currently just above 6%, according to the Department of Public Health. This is offset with the understanding that marijuana, oral nicotine pouch, and vaping use are increasing among youth, particularly high schoolers. And we do have the concern that we're trading one problem for another. There's another area of concern in that reduced smoking rates, the success of everyone here, have led to a major decrease in the Prop 56 tobacco tax revenue, which is down to around $900 million from $1.4 billion in 2017. And it may be necessary and time to raise the tobacco tax once again. Wanted to share some areas of hope in Sacramento. The American Heart Association co-sponsored Assembly Bill 573 by Assemblyman Rodriguez to grant the California Department of Tax and Fee Administration, also known as CDTFA, seizure authority to take illegal products that they find during inspections that would mirror a 2024 bill that granted the same authority to the Attorney General. I think another area of excitement is Assembly Bill 957 by Assemblymember Ortega, which seeks to make pharmacies tobacco-free, modeling action from San Francisco about 2 decades ago. Santa Cruz County has led the way to ban the sales of filtered cigarettes and cigars to address environmental waste. And I think another very important bill is by Assemblywoman Jackie Irwin to ban single-use disposable vaping devices. This follows similar action in Belgium, in France, and other countries, also concerned particularly about environmental waste. Wanted to share, I'm up in San Francisco, and our AAPI City Attorney, David Chu, sent cease and desist letters to multiple tobacco retailers who were selling flavored vaping products in San Francisco. He also brilliantly did sting operations all around the Bay Area, prosecuting retailers, particularly in the East Bay, out of his jurisdiction, but who were mailing products into the city. 5 of these retailers had their retail licenses revoked and were fined several hundreds of thousands of dollars for illegal sales, particularly to youth. I'm pleased to share that there is a Marin City that's about to introduce the complete prohibition of sales legislation, just like you've done in Southern California, in Beverly Hills, and Manhattan Beach. I have spoken with several of the lead tobacco control researchers and agencies and organizations who are facing very difficult budget cuts on this time. And they're very hopeful that organizations like the American Cancer Society, the American Heart Association, the American Lung Association can fill the gap during these very challenging times. The TEROC will meet July 11th in Sacramento and also online. I will place into the chat a link if you'd like to join to learn more about the statewide legislation. I will also place into a chat the plan for 2025 and 2026, particularly as it highlights responses to protect the AAPI community. I'd also encourage you to take a look at the tobacco-related disease research program based in Oakland, who will soon be issuing a call for new grant proposals July 1st with letters of intent due in August. If you have any questions, please let us know. I'll include a link for that funding opportunity as well. And I just wanted to conclude by complimenting all of you. Keep up your great work. I really think this is the time for California advocates to lead the nation forward. And I commend all of you for your leadership and the investment of your time today. Thank you.
Thank you so much, Dr. Ahmad. And even though there's been some setbacks because of the cut in funding to tobacco control programs, there's still hope in terms of, for example, those policy advocacy efforts that you mentioned that can continue to lead us toward that tobacco endgame goal. Thank you so much. Okay. Do we have the slides for the Asian Smokers Quitline, please? Sophia? Yeah, I know they're supposed to be. Sophia, we need the slides for the Asian Smokers Quitline, please.
I think that's okay. I can go with the slide.
Go without the slide?
Just
Okay.
go to the website then. Yeah.
Okay,
It's easy.
we'll go to the website.
Time is kind of running out. Sorry. Actually, not a good idea. I will go. Hello, everyone. My name is Cherry, and I'm with Asian Smokers Quitline. I know it's the last sections in these events, so I will keep my presentation brief. Basically, the reasons that I'm here, it's going to share about what are the resources that we can actually use to help Asian smokers to quit smoking. And I just wanted to let you know that in California, we do have a program that is Asian Smokers Quitline. It is a free service. So if you know anyone who are the smokers, actually, I wanted to show now. Yeah. So for in California, Asian Smokers Quitline ASQ is a free smoking cessation program. It is offered through the phone. So if you know anyone, they are speaking in Chinese, Korean, or Vietnamese, you can refer them to us. And the program is free of charge. For eligible smokers, they can actually get free nicotine patches up to 2 weeks supply. So it's really depending on what are their situations. So it's really good for them to talk to our coach to make sure that they are suitable to using the free patches. Besides the Quitline that offering the services over the phone, we also offer online programs. So for clients that maybe they wanted to learn more about what is actually about for the Asian Smokers Quitline, what are they doing, how are they gonna help people, what are the materials look like, they can also go to our website, and there is like different types of messages and topics talk about like how to stay quit while you're pregnant, even for smokers that when they are trying to quit, easily they would gain weight, and we do have information in the different languages to help them to quit. So those are some of the useful informations that you can refer them to. And for the clients that they are not the smokers, but they also wanted to get some information to educate themselves, to help others people to quit smoking, they can also go to our website, or they can also call us. And our coaches, they are linguistically and also culturally knowing what is the best possible information to share with you, to educate you how to talk to the smokers, or even for the vapors to quit smoking. So it's a free service that you can use. And besides, we are offering the online service, we are offering the service over the phone. We also have a texting program to support people to quit smoking through the text messaging. As we understand that not everybody, they are available to get on the phones, or for some people, they prefer to connect with some sort of the resources in a different format. And texting program is something that they can start with. And we will text them based on, when is their quit date, or if they have any questions, they can also text it back to us. And everything is in language. And what I'm going to share right now, it's our website so that you will have ideas about what it is and how we help people to quit. As you can see here, we do have the simplified Chinese, traditional Chinese, Korean, and Vietnamese, and we have our Enroll Online. So if you click on here, and it will take you to the different language forms. And then we also have a texting program. So these one, if you use it on a mobile device, once you click this, it will open up the Messenger app, and then you can text us and connect with us quickly. And we also have ASQ Facebook, so you can just search us through Google Asian Smokers Quitline Facebook, then you will find us. So pretty much this is the free service that I wanted to share with you guys. And if you can just remember Asian Smokers Quitline, Asian smokersquitline.org, that's our website, and you will be able to find all our phone numbers and everything that are available on our website. And so that's about my presentation. I'm going to turn the time back to Sophia or Alice.